So today might be one of the last little videos. I think this can kind of wrap it up for the whole gallbladder removal and recovery. Um, we'll see. I don't see too much else developing and really too much else that I could offer for advice and basically my experience. If anything else crops up and I feel it's relevant, I'll record something. But if any of these have helped, great. And if anything else I have today can help, awesome. Today is day 6 of recovery. Tomorrow makes the 1 week day since I had my gallbladder removed. And things are much better today than they were even yesterday. Mainly in most small, or due to the fact that I could actually sleep last night. And by that I mean it's been really hard to position myself at night to get comfortable since the initial gallbladder attack, and I guess we're going on like 3 weeks now since this whole ordeal began. I've had a really rough time sleeping, and after the first attack, and I was able to meet with the surgeon after the ER visit. My doctor, Dr. Lyle, told me that at night, if it's best, until I could get in and get the gallbladder removed, if I was going to sleep on my back or on my right side. And that had to do with something about the physiology of, your gallbladder and the ducts and the way the stones can move and shift around. So if you have to sleep with gallstones and they've been bothering you, apparently the best thing to do is lay on your right side. Avoid laying on your left. So yeah, sleeping on my right side with no other real options to roll over on my left, or actually be just scared to roll over onto my left, and on my stomach was rough. And I had to do that a while before the surgery. Now after the surgery, there were really no other options for me in terms of comfort and for sleeping. And they never really came out and really told me, sleep on your stomach, or sleep on your back, sleep on your stomach, sleep on your left, right, whatever. They never really gave me too much instruction. So I found that the only place I was really comfortable was on my back. So let me talk about that for a minute. If you go through this, and again, this is the laparoscopic gallbladder removal, and you end up sleeping on your back because it's the most comfortable, or that's what you're told to do, the first thing that I noticed, and we're talking first night, and this is also when I was dealing with all the nausea and things like that, was sleeping on my back. I would tend to, open my mouth. I'd fall asleep and my mouth would open, and immediately that would dry out my mouth and my throat. Now, if you remember from the previous videos, I mentioned my throat was just completely torn up. I know I haven't included a picture of it. I do have one or two, but my throat was a wreck on the inside, on especially the right. I mean, it was black and blue and it looked horrible. And sleeping with your mouth open, falling asleep like that, and then drying it out was horrible. So if you do have to sleep on your back, one of the things that I learned pretty quickly after a couple nights, thank you, Mary, for pointing this out, was, prop myself up even more, and that would keep my head forward and I wouldn't open my mouth. But if you go through this, especially with that, when they intubate, and if it tears up your throat, what we did is Mary went out and got me some chloroseptic spray. And, it's just a tiny little bottle, and I would keep that by the bed. And at night, if I woke up and my mouth was open, or I dried it out, or just my throat was hurting, I would do a couple shots of the chloroseptic, and that helped at least get you back to sleep. So keep that in mind. Prop yourself up a little bit more so your head's not completely rocked back and your mouth isn't open, and keep some water by the bed, preferably in a container with a straw, so you don't have to mess with it at 3 o'clock in the morning. So yeah, that's the first thing. This whole little video here is probably about comfort and getting by. The second thing was I dealt with a lot of nausea, as I've mentioned before. And again, I don't know if that was in part due to the anesthesia or in part due to the fact that I had that, the gallbladder removed, or a combination of both, or whatever. I suffered a lot from nausea, and they did give me some medications for it. Some of them help, some of them not so much. They gave me one, what's it called? Ondansetron. I can't even pronounce it. Ondansetron. I can't pronounce it. But it's a little tiny little pill, and you let it dissolve in your tongue. That one, I don't know if it really helped me that much. I guess it did, but not too much. The better one for me was the the one you swallow. These look like the same thing now that I look at them. That's strange. They're both 4 milligram. One you swallow and one you melt on your tongue. Weird. The one you melt on your tongue, it just didn't seem to do that much for me. That's crazy. I didn't realize that they were the same thing. But the one that you swallow worked great. That's really weird. It gives you a little bit of a headache though, so I would take a Tylenol with it. But they also help with the pain meds, and if you're like me, pain meds make you sick. I try to avoid them at all costs, especially, I guess my nemesis is Percocet, and that's unfortunately what they gave me. I had to call or actually Mary called for me, like day 2, and beg them for something else. And they did call in another drug, but they make me real sick, and so the anti-nausea helped with that as well. But long story short, one of the things that I've always done is I'm a big ginger freak. I love ginger, and that really helps with nausea. So I like to have ginger beer near me all the time. This is Bundaberg. I don't know if you can even see it there. This is it's probably one of the best ones out. In my opinion, there's no artificial sweeteners in it or anything like that, and it has real ginger in it, and that's the key. If you're going to drink ginger ale, ginger beer, I say ginger beer, they're non-alcoholic. It has to have real ginger in it for you not to be nauseous, and for it to work, for it to do anything for you. So you can't get a cheap ginger ale from the store and expect it to do anything if there's no ginger in it. Another thing that I like are the ginger juice. I've got this huge bag. Of just different flavors, and different like Chimes makes the Gingin People, I think, is another one. There's a few out there, but they're really good, and they really do help. And they've got all kinds of different flavors, like I said, like mango and spicy apple, and there's some coconut, and there's even some coffee flavored and peanut butter flavored ones. But if it's got real ginger in it, it will help settle your stomach and help you fight some of the nausea associated with either the drugs or the surgery or whatever. So if you can get yourself some good ginger candy, some ginger beer, some ginger ales. And I've heard making ginger tea with the actual ginger root is really good too. I haven't tried that yet. And I don't think I'm going to need it, but we'll see. So we talked about the throat, the chloroseptic, propping yourself up at night, that helps. Fighting with the nausea, ginger is awesome. Don't be afraid of the drugs. I'm kind of still blown away about the 2 different anti-nausea drugs. I didn't realize that they were the same thing. I guess I'd never really looked at them until now. The other pain medication, I guess I can talk about it, that I asked for and I'm familiar with because I have had some been battling with some torn meniscus discs in my left knee for almost a year now, and one of the only pain meds that kind of does anything for me that doesn't make me sick is called tramadol, and it's low dose. I asked for the lowest dose that they can give me, but it doesn't make me nauseous. So you could try that. You could try asking for it. I don't think it's anywhere near as powerful or as potent as Percocet and all the big ones, but it does work. It doesn't make me feel loopy. It doesn't knock me out like the other drugs do, but it knocks out a good amount of the pain, more so than, you know, taking a few Aleve is going to do, or Tylenol. So tramadol, you know, you can ask for it. Maybe they'll give it to you, maybe they won't. I have seen it on a couple places where they did prescribe it for somebody with the laparoscopic gallbladder removal. So that's another thing. Bloating and that gassy feeling. I'm still really crazy bloated, but the gassy feeling just with the digestive system, one of the things that has helped me is Rolaids. And you know, I'm sure everybody's familiar with Rolaids. You can get those things anywhere. They have helped quite a bit over the last couple days, just with the buildup of gas. And one of the, I mean, I mentioned it in the last video, but one of the issues is just you feel kind of blocked up, for lack of a better word. And not to get too descriptive or too ooky, but you just feel kind of blocked up, and it's, you know, real gaseous, but you don't have, or at least in my case, the ability to kind of pass gas and pass those issues along. The pain meds can block you up. I think the surgery does things. You certainly don't want to strain. That's the last thing you want to do. Even laughing kind of hurts. I sneezed once or twice and thought I was going to die. So you can imagine feeling blocked up and going to the restroom. But the weird thing is that when you know, I'm trying to get too gross here, but as you do, you strain, you move things along, but the best way I can describe it is you can't. Does that make any sense? When you try, you feel like all the effort you're putting in is going straight to your head. All that pressure to, you know, move things along, it's going up to your head, into your chest area, not down where it needs to go. And I'm hoping I'm praying that goes away soon. Because they told me to get stool softeners. And it's really one of the only ways to kind of, again, move things along. And coffee, not going to do it. I've even went so far as to get some Metamucil and try that. You know, call me desperate, but, and again, I don't want to make this entire video about that. So get yourself some Rolaids, get yourself some stool softeners, especially if you're on the Percocet. Apparently that blocks you up, and I guess it did me as well. But I think part of it is just my system is completely, well, not completely different, but different enough where I've still got a bunch of swelling and healing and bruising and all that going on in there, and it's affecting other areas. And I think it's getting a little better. But yeah, it's just one of those things. Watch out for it. And if these videos help at all, get the stool softeners. Just do it. And don't be afraid of the Metamucil and all that either. Trust me, you will want it. It beats going online or calling the doctor and saying, help, you know, I don't know what to do. Or why is this happening? But I think that's what's going on. I think it's a combination of the painkillers, and I think it's also just the fact that you just had surgery. You had a piece of you cut out, and you're kind of recouping from that. Aside from that, I don't think there's too much else to offer. Channel 10 in Charlottesville did show the video of me in the OR and them going in through the belly button, and they interviewed my surgeon, and they showed little tiny clips of me, you know, when I guess I was completely out cold, so I don't remember any of it. Getting pulled from one table to the next, and it was just kind of weird seeing myself on TV like that. But yeah, I'm rambling. So yeah, I think that's about it for now. If I can think of anything else, or if anything else comes up or happens, I've got my final appointment or my follow-up appointment with my surgeon next week. I might just do one little tiny blurb about that and how that goes. The diet is slowly improving. I haven't found anything that's really turned me off or done anything or affected me adversely, but you know, so far so good. So what is this, day 6? and things are looking a little more up. I'm still super sore. I get fatigued really easily. This video is going way too long, 15 minutes now. And I'm really tired. All I want to do is sit down right now. But yeah, that's it. So I hope that helped. I hope these videos helped. If they did, maybe they were a little entertaining, who knows. And I hope maybe I answered some questions or gave you some advice. So thanks guys, thanks for the support. And I think that might be it. We'll see. Bye-bye.